I'm Shannon Weber with HIVE, a hub of positive reproductive and sexual health. I'm in Foster City, California. It's November 19th?
20th.
2015. Here with?
My name is Elyse Tung, and I'm with Kelley-Ross Pharmacy up in Seattle, Washington, and we're operating one of the first PrEP clinics out of a pharmacy.
It's so exciting. So did the pharmacy was already in existence, and then when did you guys start offering PrEP?
The Kelley-Ross Pharmacy has actually been in Seattle since 1925, and one of our main focuses has been innovative, progressive models of pharmacy in all areas. And so I went to a global health conference back in 2014 where the original data for the PrEP guidelines came out, and was inspired and brought it back to our partners and said, we need to be doing this in the pharmacy. We need to be getting PrEP to our patients. And so from then on, we started creating a model and on how to implement it within a pharmacy.
And so this is a one-stop shop.
It's called One Step PrEP.
One-step PrEP.
One Step PrEP. And what it does, since we are the pharmacy, and under a collaborative drug therapy agreement with a physician, we are able to do all the screening, all the testing, all the counseling, all the education, the dispensing of the medication, the adherence, and all the follow-up in one location at one visit. And so a patient who is interested in PrEP can come on in, get seen, get everything done in an hour, and if they qualify, they get to walk out of the pharmacy with medication in hand.
It's so amazing. Are you guys able to do PEP as well?
It is something that's in the pipeline, and we're working on our protocol to do that. But yes, we hope to do PEP to PrEP.
Yes.
Very soon.
When did you start?
So the clinic officially opened in mid-March of 2015, so just about, 10 months ago?
Yeah.
And we've been constantly enrolling new patients and doing adherence calls and refills for everybody. And so we are over 100 patients, just under 200 right now.
It's so exciting.
Yeah.
How are people finding out about the PrEP clinic?
A lot of it is social media and through the internet, and a lot of our marketing efforts have been geared towards that. We do a lot of outreach in our community-based organizations locally. So we're tapping all these different avenues to get patients in. So
and
it's not just one solution.
And what do you think your capacity is? So what's your dream?
Oh gosh, my dream would be more pharmacists. The more pharmacists we have and the more space we have, the more patients we can see. Because it is on a pharmacy level, we're tapping a patient population that doesn't typically have a primary care provider already. And so we're getting them access to the PrEP that they need and then getting them inserted into the healthcare system. Because these patients know or feel that they have a risk and they just don't know where to go. And so a pharmacy is so easily accessible versus making an appointment with your doctor and then going to the lab and then waiting a couple of days for the lab to come back.
Having a referral from your doctor to the other doctor.
Yes, and then waiting for that to come back. And then you finally get a prescription and then you have to go to your pharmacy and the pharmacy has to bill it, and then sometimes there's a PA and then you have to wait 7 days for that PA. You got to wait for the doctor to respond to the PA first. And then you have to wait for the insurance company to respond to the PA. And so a lot of times we're looking at several weeks before a patient can get access to medication. And what we're able to do is narrow it down to a 1-hour experience. So we capture them at their highest level of interest and we get them started.
It's so exciting. Thank you for sharing.
Thank you for having me.